All right, what's going on, everybody? Now, I'm about to tackle this whole monkeypox disease thing that the Health Organization says is now a health emergency. And, a lot of cases have been found in Africa, and they're not talking about any type of lockdown at the moment. I read an article about that earlier today, and the experts said there won't be any type of lockdown. And thankful for that. And I remember the last one, and the only thing open around here were the grocery stores. So we definitely don't want to go through a whole type of lockdown scenario. But monkeypox is something that they are keeping an eye on, and they have different ways in which it's been spread. One of the ways has been the whole man on man having sex with each other. That's one possible way, and I want to talk a little bit more about that. Right now, I'm gonna play the video in a second, just so you all can get a little bit more background on it, because this is definitely want to protect yourself from it. I would say, but other than that, yeah, it's not something that you want to play around with, and it's not similar to chicken pox, but it can be transmitted through skin on skin contact. I've seen that as well, so that's something. And so, if you have any symptoms, they say go to the doctor, make sure you get yourself checked out, that whole thing, and then just go from there. So it's definitely not something you want to play around with, I would say. Let me just get the screen share together. Then I can show you guys what I'm talking about. Here we go. Let me play this for you guys. Get the video started. Might have to refresh it. Hold on.
Global health alert. The World Health Organization has declared Mpox, formerly known as monkeypox, a public health emergency. Ariel Reshef is here with the details for us. Good morning, Ariel.
Good morning to you, Michael. Global health officials are warning about the surging cases of a more severe strain of Mpox in Africa. The WHO hoping countries will now work together to help stem the tide of the virus spreading on the continent, mostly now among children. This morning, the World Health Organization declaring Mpox a public health emergency of international concern as cases of a dangerous new strain spread across parts of Africa. The version of Mpox now circulating in more than a dozen countries on the continent, far more severe than what the U.S. saw in 2022. Back then, the majority of people infected were gay and bisexual men. But according to the World Health Organization, those most at risk today are under 15. They account for over 70% of cases and 85% of deaths. Fatalities worldwide topping 530, while the total number of cases is up an alarming 160% compared to last year. The strain in Africa hasn't been seen outside of that continent, and health officials here in the U.S. stress there is no elevated risk in this country. Cases of the disease here remain far lower than 2 years ago. Mpox typically spreads with close skin-to-skin contact. It presents with symptoms like a blister-like rash, fever, muscle aches, and fatigue. But the WHO says they're examining different modes of transmission.
Unsurprisingly, viruses will continue to evolve. We saw this with COVID, and now with Mpox, we see new versions of the virus that become more transmissible or potentially more fatal.
And again, health officials here are making it clear that there is no additional threat in the United States. But if you think you may be at risk, talk to your doctor and consider getting the 2-dose vaccine. If you've already done so, there's no recommendation for a booster at this time. Guys?
Good to keep in mind. Ariel, thank you.
So there you have it. They do have a vaccine available, the 2-dose. If you feel you have some of those symptoms, it's crazy that it's affecting a lot of people under 15 at this point. I think it started out really affecting gay men, and here's another article about that where it said the cases, a lot of the cases that have been found were in the communities of gay, bisexual, and other men who have sex with men, transgender people, and gender diverse people may also be more vulnerable to get, this disease. But up until now, at this point, now it's affecting mostly people under 15. I guess anyone can still be at risk. And then you see some of the symptoms here: fevers, swollen lymph nodes, muscle, not sure how to, muscle aches, headaches, low energy. If you feel you get any of those type of symptoms, it might be good to get checked out. It is been declared a health emergency, but I don't think it's anything that we really have to worry about right now. It's just funny how, 4 years ago we had the other uh, virus, and now this is, getting some type of traction, but nothing that's going to cause any type of lockdown. Election year. A lot of parallels between 2020 and 2024. That's for sure. And so it's also spread through skin to skin contact, and that's just something to really be mindful of when you're outside, who you're around. Continue to wash your hands, and try and keep yourself, as clean and as safe as possible. You definitely don't want to get any symptoms of this, or have to get a vaccine again or anything like that. And so the official name now is Mpox. It was Monkeypox. Now they've shortened it to Mpox. Same thing to me. They're just shortening the name for whatever reason. So the World Health Organization is on the lookout. I know back with the other virus, some people thought it was maybe planned, things like that. Some may be thinking the same about this if it were to get out of control, because it just seems like some different disease just continues to come throughout the years. There's no cure, just vaccines. And then again, like you say, 2020, 2024, just so many similarities, presidential election. And now here's the threat of this. They're keeping their eye on it. It's only August now, so we'll see how it does for the rest of the year. You never know. So let's just keep our eyes out on the news and what else may be coming down the pipe as far as our health goes and what the WHO says. And, be on the lookout for those symptoms. And then just be careful who you're around, who you come in contact with. No one wants to get sick. I haven't heard about any people passing away who have had monkeypox. They do have the vaccine, so I haven't heard of any deaths being reported up to this point, but it is something that's being looked into. And so, it seems to be a lot of cases in Africa as well. And so that's definitely a place that they're keeping an eye on, just in case, anyone who's traveled there mess around and bring something back. And so it's saying right here on the same day, the WHO published a report. They found that a total of 934 new lab confirmed cases of monkeypox. Oh, okay, and I spoke too soon. And 4 deaths from 26 countries in the month of June, so 2 months ago. So I spoke too soon. There has been some deaths. And so, okay, so it is a deadly disease, so that's something to keep in mind. It can kill you. Luckily, they do have vaccines. And this was found from, it says 26 countries, so it's got to be from people traveling, and people are spreading it, probably not knowing they're spreading it. And that's why it's, jumping from country to country so quick that I'm thinking. Yeah, 26 countries, that's a lot of countries for it to be moving around so quickly. Let me see. Let me go down a little bit more just to see exactly what else they're talking about on it. I just wanted to update people on the latest situation. I saw this article on MSN.com, and I said, let me talk to YouTube about it just to inform some people, especially those living here in the United States like myself. And then if wherever you are in the world, that need to be careful. And so let's see here. Yeah, there's some more here about, say there have been no cases of Mpox reported outside of Central and Eastern Africa. So it seems to just be isolated into Africa, nothing in the United States as of yet. And the risk of this type of monkeypox, according to, let's say, is low for the American public, but is low to the American public, according to the CDC. So that's good for people living in the United States, but you know, I would still keep my eyes open. You just never know. As soon as they start talking about there's no cases found in one area, a month later, and then you get the first case, and then everything just goes all downhill from there. It's like a domino effect. And then you have, this is the name of the vaccine here. Not sure how to pronounce that, but you can see it here. That's the vaccine that they have for it. So at least they have that, like I said. And the FDA has approved that. So I don't know how people feel about vaccines, or you know, what's been tested and what you're putting in your body, but they do have something for this if you just so unfortunately come in contact with it, as it has claimed 4 lives already. So yeah, these diseases, we just have to really be careful, you know, whatever may, you know, come about, and you know, protect ourselves. We, even with any type of conspiracy theories people may have, are they putting this out, or whatever the case may be, it's good to protect yourself. I would say, don't, you know, you never can be too careful. And so the fact that they're declaring something a public health emergency, I think, is something to actually be on the lookout for. You don't want to take that lightly, because you just, you know, you come in contact with it, or someone you know, and then at that point, it's just kind of like, okay, what is this? Where did it come from? So we just got to protect ourselves, be on the lookout for the symptoms. And so I didn't want to do too much on it. I just saw that it was declared a health emergency, and just wanted to really come in here and do a little update on it, the ways it's being transmitted. Seems like it started out in the gay community at first, where they were finding a lot of cases on how it's being transmitted. Now it's being seen in more people under 15 years old. But then it also said that these cases have only all been in Africa. So nothing outside of Africa at the moment. So it's spreading there, you know, that's a big continent. And so it won't be anything for us to, you know, just grow legs and end up coming out of that continent of Africa at this point. So even though it's just been isolated to just cases over there, you know, keep your eyes open. And so this is, you know, it's definitely something. And, you know, you don't want anybody, you know, catching it, getting infected, you know, anything like that. So, you know, whatever's going on in Africa, yeah, that it's really affecting people over there. And so, you know, a lot of these diseases, they start in one location, and then just so easily, you know, you find them finally in a new continent, and then it starts to spread from there. And so definitely something to, keep an eye on. And so I don't know how much you all have heard about it, what you think. If anyone's listening who's been in Africa recently, anything like that. If you feel anything, like I said, get yourself checked out. So this is just my little public service announcement for this particular disease and just what may happen next, what could happen next. Keep your ear on the news and see what else comes out, what the World Health Organization says next about this. So I wouldn't worry too much, just be safe out there. And you got any thoughts on monkeypox and how it's spreading? Let me know in the comments. Again, like, share, and subscribe. And I am out.